Okay, so this is chapter 28 in your chapter, which we're going to start to talk about the role of public health nurses, and this role is in the federal, the state, or the local health departments in federal work or state work or local work. We have to be aware of how our government works. We have to be aware of how the laws affect health, how health policy affects our nursing practice and affects our communities. So one health policy like the soda tax, we understand how the policy is to encourage people to drink less soda. Those who do drink, then that soda tax is used to supplement Head Start programs and assist children in poverty. So when we understand that, we can help to explain things to people. We can help to interpret those policies and laws for people. So you see this middle point about working on multidisciplinary teams. And nurses often work with physicians, physical therapists, social workers, hospitals, home care nurses. So, you know, we are aware. We may be case managers where we're aware of all the services being provided to a client in the community as well. We work with coalitions. We gather together to discuss issues that we're having and to try to solve solutions. When one of the master students was working in Norristown, she was working on maternal child health, and Norristown Health Department was bringing in all the groups that work with children and work with pregnant moms, including food banks, including social work agencies, including Head Start, and they all discussed their issues, their desires of how the team could work together, and decided to meet on a bi-monthly basis at the health department. So the health department took a type of control of that to encourage people to work as a coalition of public health people in pediatrics working with children. So know these definitions. A health policy is a policy that affects health, and what is a policy? It's a course of action to be followed with clearly stated goals, clearly stated action, and often policies can be affected by politics. We know that the policy of abortion is very political at this time, and senators and House representatives are working to influence each other to vote the way that their values are held. Be familiar with these organizations just for your own knowledge. You won't be tested on these because there's so many. Some of them we've talked about before. The World Health Organization was started after World War II to promote health in all of the nations that joined. Not all nations are members of the World Health Organization, but they send out consultants. They have public health nurses who are consultants, who set policy, who go into countries and help them write their policies, help them formulate what they want to be done. Our federal health agencies in the United States, we have DHHS, which is, again, a federal health agency in charge of the health and the human services of the United States. That is a cabinet post under the president, reports to the president. We have the HRSA, which is the Health Resources and Service Administration, which works to provide those health resources needed in the communities. The Centers for Disease Control and Prevention, the CDC, the NIH. We know they're very important to providing information and providing guidelines, doing research. The NINR, the National Institute of Nursing Research, sets those goals for nursing research, the important topics, and unfortunately not many of those topics are public health. related, but we're continuing to work on that. AHRQ, which is health research and quality, looking at the quality of hospital care and provider care, and then the Centers for Medicare and Medicaid Services, which are setting policy for what Medicare and Medicaid services are covering. Here are some other ones that we've talked about. The Department of Agriculture, which I believe provides the WIC program, and Department of Labor, which public health nurses would want to be aware of because they do regulate the labor practices. And then we go down to the state and local health department level, which some townships do have a public health person that would make the information that would come from the CDC that needed to be reported in the case of an epidemic. That public health person would be responsible for making sure that services were there, that people were credentialed and ready to serve. And then the local and the state work together and can get assistance from federal agencies. So we've talked about some of these policies and legal issues that affect healthcare practices. We know that school nurses are under reporting requirements, cannot give medication unless physician orders. Occupational health nurses have criteria they have to report. Home care and hospice nurses are highly regulated. A lot of legal issues. You cannot abandon a patient. Is a patient safe at home? Is there elder abuse? And then correctional health, which is the prison health system. So how can a nurse play a role in the policy process? The nurse can testify before Congress, before local, state, and House of Representatives, testifying to what the nurse has seen in the home. The nurse can give feedback related to legislative action. So if our Senator Casey is putting forth a legislative action, we can give our feedback how that would affect our population so that all populations have a voice. We are aware of the regulatory actions, what regulates our practice, what regulates the people of our community, and then we are advocating. So you can look at this. We've talked about these. These are the core functions of public health: collecting and analyzing vital statistics, providing health education, receiving reports, protecting the environment. We've talked about these before. Be familiar with these because these are the actions of public health nurses in general, but also of these local, state, and federal agencies. Okay, so here we see a little bit different description between federal, state, and local. The federal is getting policies from Congress, getting funding from Congress to carry out health services. They may be surveying the nation's health versus a state's health, which would be the job of a state public health nurse. So where the money's coming from and what they are doing and who is directing them is part of the description. And you can look up the United States Public Health Service if you're interested in the civil service. You have to be 43 or less to get a job with the U.S. Public Health Service. I'm not sure why they do that, but very strong organization to work for. Under the executive branch, which is under the president, the National Institute of Health is under there, and then the NINR, which is the National Institute for Nursing Research, is part of the NIH. Peace Corps, if you are interested in Peace Corps, is under the executive branch, and Congress is setting their funding. So those are just some things to tuck into the back of your head. You wouldn't be asked about what specific jobs are under the executive branch. So now we go to the state agencies, and this is the governor that may be giving direction or policy with voting between the House and the House of Representatives and state senators. We monitor the health status of the state laws and regulations. And so one example of that would be that currently abortion is under the federal law and federal policy, but if that changes, if the Supreme Court changes that, it may go down to a state action, which means that each state would determine whether they would allow abortion or not in that state, and the public health nurse of the state of Pennsylvania would have to know what the ruling is, what the policy is, to enable to in order to talk with clients, to talk with providers. And then this last one is provide oversight and consultation for local public health agencies. And local agencies often have a professional nurse or physician working there, but who aren't heavily working in public health. And so they have volunteered or they've been voted in, and so they can get information from the state health agency. Again, the local's goal is to safeguard the local public health and to improve the community's health status. I live in Upper Dublin. We have a health person, and then school nurses could be considered local. They have several of them in the North Penn School District, which is the Lansdale area. And they look at enforcing health codes and ordinances, and local typically follows the state, and state mostly follows federal, but there can be discrepancies there. But local would follow state policies. Okay, I'll let you read over this. Issues and trends in public health nursing. We've seen some, such as social reform, social welfare reform. We have ethnic disparities in health outcomes. This is more of a topic that we talked about in the beginning. Remember to review the core public health competencies. Make sure that you understand that, because that will be on the final exam again. And public health nurses should be aware of what the job is, what the skills are, what the knowledge and attitude is that is necessary to be a good, effective public health nurse. We've seen this slide before. Remember, public health nurses are advocates, they're case managers, they are referral resources, they assess literacy, they are educators, they direct primary caregivers, they are role models, and they respond to disasters. And we will be talking about disasters in a week or two. Thank you.